It's the London Free Press podcast, indeed. And we are talking about COVID-19 and the outbreak in this community and communities all over the world, of course. And to do that, we are joined by London Free Press health reporter Jennifer Bieman. Hello, Jennifer. Thank you very much for joining us on the podcast again.
Thanks so much for having me.
There's a lot going on, obviously. People in this community are wondering, when are we going to go from yellow to orange? What's going on within spread in this community? But the big thing people are wondering about is University Hospital. You've written quite a bit about the outbreak at University Hospital. Tell us what is happening with that, what we at the London Free Press know about that right now.
Well, it's just a really upsetting situation all around. It's the biggest outbreak we've had in the London area to date, the whole pandemic. As of today, 124 cases among staff and patients there, and 10 deaths, which is just kind of mind-boggling. We haven't had that sort of death toll in this area in a long, long time. The health unit has investigated and done their thing, and they've said that, the situation may have been exacerbated by, kind of rule breaking among staff. LHSC is also investigating just how this got so out of hand. The very first outbreak was declared in a fourth floor unit on November 10th, and it's since spread to 5 others. They've basically shut down the hospital. They've cut 3/4 of their surgeries. Only emergency surgeries are happening. No visitors, with very, very few exceptions. So things are pretty dire there. And we haven't had this kind of level of crisis in London or Middlesex County since really the first wave.
When you say potential rules being broken by staff, what are we hearing about how those rules may have been broken? As you said, there's a couple of investigations. What do we know about those?
Yeah, so certainly finger pointing is not the thing right now. We just want to get this contained and done. The health unit has said that maskless staff in break rooms have been a potential issue. The hospital has said as much. There's this persistent, unverified claim of a staff potluck that the hospital is looking into. At the end of the day, it'll take quite a bit of soul searching here to really figure out what went wrong. Not just, it's certainly not just staff at all. It could be hospital things as well. So, I think people are really searching for answers for reasons why a hospital that does so many things well and so many things right and has so many policies and procedures in places for handling outbreaks could really end up in such a situation.
Yeah, that's a great question because look, the rules there are very serious, of course, and they're posted all over the place. I have not been inside the hospital myself, but I've seen this for the photos on social media. I know what's going on there. So the question I'd have for you is, if we don't obviously want to point fingers right away, what are health officials saying and hospital officials saying about how we make this right, or how we get this COVID-19 outbreak away from University Hospital? What are the steps that have to be taken?
So they're really taking a lot of those steps right now, canceling all non-emergency surgeries there. That's a tough move. The province has really signaled through the second wave it wanted hospitals to be able to continue those, but those are done. And outpatient clinics and appointments, those are being moved online when possible and canceled outright if it's not possible to move them online. They're testing everyone at UH, all the patients, all the staff, thousands of people, just to really get a handle on this. They're inspecting units, hospital staff are as well, just to make sure everything's being followed. The health unit today, Chris Mackey was saying that he's confident that with the rules that are in place and with the steps that the hospital and health unit are kind of taking in tandem, that they will be able to turn the corner on this. And we've got also a lot of hospital staff that are work quarantining. So they go to work, they work their shift, they go home, they quarantine. And that's a kind of a brutal situation to live like that, but that's certainly one of those steps.
Yeah, no, it definitely would be a hard life to live. And I think there's a lot of people who are, of course, very appreciative of hospital workers right now. And as you said, there perhaps might be some finger pointing going on in the communities and people blaming certain folks. But the reports of potlucks and things along those lines are unconfirmed. And even if something like that did happen, it certainly wouldn't have involved all staff at LHSC, at University campus or Victoria campus or wherever it happened to be. It would have been a small number of folks. I get that it's still reckless behavior in these times, but we have to be very careful to acknowledge that staff at these hospitals are doing everything they can to get our community through this, including dramatically shifting their own lives even when they're not at work. And I think that's got to be acknowledged.
100%. Yeah. They're moving mountains to really make this right. And you can tell they've taken swift action last week to get things going. It's just kind of a real shock. And I think that that's the way a lot of people in this realm feel. We're talking about a hospital that's very well resourced, that knows how to handle outbreaks of influenza or C. difficile or MRSA, and yet to be kind of hit by this so badly, I think it's been a shock for a lot of people.
Certainly, certainly. So, what's the situation in the community at large right now? Obviously, we're seeing daily case numbers go to levels that we've never seen before. Of course, a lot of that is because of what's happening at the hospital. But what's the situation in London and Middlesex County as a whole right now?
So, again, like you said, case count's really high. University Hospital is a big culprit of that. There are secondary cases, so outbreak linked cases at that hospital. Close contacts of those people. So there are about a dozen or so of those, and more are under investigation. The good news is health unit contact tracers are able to figure out most of the time, for the majority of cases, where they're coming from. So there's not a very large contingent of these kind of mystery cases that we don't know where they came from. But people are on edge, certainly. I mean, this is not a good news situation, and this could push us into a different restriction level, which is, something that I think a lot of people have been worrying about.
Yeah, that's actually brings me to my next question. I know a lot of Londoners have said, "Hey, are we going to Orangetown? Or going to Orangetown?" We've seen similar sized communities to ours go to the red zone. I know that's where they are in Kitchener-Waterloo right now. There's rumors in that community that there's going to be lockdown-like steps taken there, like we've seen in Toronto, like we've seen in Peel region. What are the situations here in London when it comes to, are we staying in yellow? Are we going to orange? What are health officials saying when we ask them about that?
So health officials are saying, we're very much in a few certain metrics in the strictly, very nicely in the orange category. It will depend on what the province decides with their medical officer of health, and in consultation with ours here, whether we move into that orange level. I wrote a story yesterday that kind of itemized some of the criteria here. And there are some where we are fully, absolutely, no questions asked, in that orange zone. There are others where, we're kind of straddling the line. We're sort of in yellow, could be in the orange. Right now our contact tracers at the health unit aren't super overwhelmed. They're dealing with a lot. They brought extra people in, but that's one of those metrics the province looks at. And there are others as well where we just don't necessarily fit that bill. But I really, from what I'm hearing and from what I understand from the health unit, I wouldn't be surprised if we did move up that category.
Yeah, which I know that a lot of Londoners don't want to see happen, but it may be inevitable at this point. That being said, when we look at the two categories, the differences between yellow and orange, I don't see there'd be a significant impact on the lives of most people in the community. Would you agree with my assessment there that for most of us, the difference in how we live our lives in the yellow zone and the orange zone is pretty negligible?
I would agree, unless you're running one of the businesses that's affected. There are capacity limits that are introduced in the orange zone that aren't really existing in the yellow zone. So if you're running a business or something, that's another thing that you'd need to consider. But no, the difference between yellow and orange is not as big as the difference between yellow and red. And like you said, places in our region are really flirting with that red line, including Windsor, Essex as well. So yeah, I think that the from what I've seen anyways, for the lives of just your average Londoners, it's not necessarily a given that an orange restriction level would have a lot of impact on their day-to-day lives.
Yeah, I would. I would echo that, and I would understand that the what people don't want to see that happen. The way to avoid that, of course, is to stay home and not do Christmas gatherings and things on those lines, because we don't want to wind up in the red zone like we've seen those other communities I mentioned wind up in. And we certainly don't want to be in the gray lockdown zone like we've seen in Toronto, like we've seen in Peel, and like we may see in other communities as well. And those types of things, of course, are on the table if we can continue to see case counts get higher and community transmission continue to happen, right?
Yeah, we've shown in London through this first wave and through the summer that we can really come together as a community to get this under control. And I think it'll be telling the next couple of weeks what happens at University Hospital if cases come under control there. We will have more cases. There's no question. They're testing like crazy there. So we're hunting the cases. We're going to find them. But it's just a matter of seeing whether we can really kind of move beyond this, over 40 cases we've had for the last 2 days back to where we were, to kind of the normal case levels we were having. So I think it really takes vigilance on all of our parts, and especially with Christmas. I mean, just making decisions that are sound and follow the public health guidelines, that'll really go a long way to getting things back to where we want them to be.
Yeah, and that's I think what all of us definitely want to see sooner rather than later. Of course, there's questions about vaccination and things along those lines. Those are for federal health officials to announce. But for now, we've just got to sort of put our heads down and keep doing what we've been doing. And of course, hope that we don't continue to see outbreaks at hospitals and things along those lines, because that's where things become real dangerous.
Absolutely. I mean, this has been a really rough couple of weeks for London. Last week was brutal. We had a lot of deaths this week. Just in the first 3 days of December, we've already surpassed November's death toll. So, December 3 days in is now the third deadliest month behind May and April. And that's all but one of those 8 cases in the first 3 days of December is due to the University Hospital outbreak. So really, everybody is wanting this to really resolve, and I think that we're taking good steps to do it, at least.
Yeah, I hope that that's exactly what happens. Anything else that you're going to be watching, Jen, over the next few days here as the story continues to evolve, either at University Hospital or in the community at large?
Well, the province lately in the last few weeks has been making its new restriction announcements every Friday, it seems. So I'll certainly be watching that, as well as of course, the University Hospital outbreak. Hospital officials are going to be speaking at a press conference Friday morning just to sort of discuss their response and how they're working through this. So that'll be on my plate for the next little bit.
All right. Well, we continue to read your coverage, which has been fantastic. You have several pieces that are on the front page of lfpress.com right now with a lot of great information in them. And what I liked about them is there are bullet points. Here's essentially what you need to know. Here are the different things that are going on. It's very easy to read and take in the information that you want. So go to lfpress.com and within the page of the London Free Press, read Jennifer Bieman's work. Jennifer, thank you so much for talking with us on the London Free Press podcast today. Glad you could do it.
Thanks so much for having me.
As Jennifer Bieman, London Free Press health reporter, talking with us here on the London Free Press podcast today, a podcast that you can subscribe to on Spotify, on Apple Podcasts, on Stitcher, or on Google Podcasts. Plus, you can find us on lfpress.com. You can also go to YouTube, where thousands and thousands of people are tuning in for our podcast and the little videos that we do. You may be doing that right now. So if you are doing that, thank you very much. And we're glad that you could be part of the London Free Press podcast. We'll be back with a couple of more episodes next week. We're continuing to watch what's going on with COVID-19 and all the other important stories going on in London and the surrounding region, which is what we talk about here on the London Free Press podcast. We will talk to you next time.